Our country is in the beginning of an obesity epidemic. 1 out of 3 children are considered overweight or obese. Over $190 billion are spent yearly on obesity-related illnesses, and nearly 50% of Americans will have to deal with diabetes brought on by excess weight at some point in their lives. Locally, the Lakeland and Winter Haven area was recently deemed the 7th most obese metropolitan area in the country, with nearly 40% of our residents being considered obese. In an effort to meet this challenge head-on, Polk Vision and over 70 other community stakeholders have come together to help form Building a Healthier Polk. With us today to talk about this exciting new initiative is Dr. Daniel Haight, Associate Vice President of Community Health at the Lakeland Regional Medical Center, and Sarah Roberts, Executive Director of Polk Vision. Good day, and thank you for being here.
Hello.
Sarah, what is Building a Healthier Polk?
Building a Healthier Polk is a coalition of public and private citizens and organizations who are working together under the guise of Polk Vision to really decrease obesity rates in Polk County.
Sarah, what is the goal of this initiative?
The goal of the initiative is to decrease obesity rates in our county, and we do that through 6 strategy areas, which include school-based, work-based, post-secondary, neighborhoods, the community at large, and working with our physicians to work with their patients to really have a long-range plan on becoming healthier. We also have a communication strategy where we're going to infiltrate the community and all these different areas of focus to talk to them about why obesity needs to go down and why we all need to take better care of ourselves.
Oh, so really using education as the backbone for causing change.
Exactly.
Interesting. Dr. Haight, why is obesity such a major problem that we need to focus on right now?
Well, we were very fortunate to start with good information, a complete countywide assessment of all health issues. And at the core of many of those issues we discovered, there was at the center obesity. We know we have a diabetes problem. We know we have many people suffering from high cholesterol. We know many of your viewers out there have arthritis and achy joints. Well, you look at having an overweight situation, the pain you can cause in joints, the way your sugar gets higher when you're overweight. We know we have high blood pressure and heart disease problems. Well, if you're overweight, your blood pressure is probably higher, putting more strain on the heart. We know far too many people get strokes. So we also see that high blood pressure and obesity is tied to that. So we really zeroed in on obesity because we saw that if you have obesity, you're dealing with issues like diabetes, high cholesterol, arthritis, even bullying in school. You're also dealing with mental health issues. And we know a lot of folks out there sometimes suffer from depression, and it's hard to really stay on a diet and keep active and exercise. But what's good about Polk County, there's a lot we can do about it. We can use these 6 strategy areas to improve our environment, to help our kids in school, to help our employers. Lakeland Regional Medical Center has 6,000, almost 5,000 employees. We can work with other employers to keep people healthy.
Interesting, that's great. I know that your group's motto is a habit today equals a lifestyle tomorrow. I think that's great, by the way. But what does that actually mean?
It's really about making one small change every day. So we're not asking people to shed 50 pounds all at once in a 6-month time period. We felt like as a group, if people could make simple everyday changes like taking the stairs at their workplace, if they can take a piece of fruit in their lunchbox versus a candy bar, if they could do simple 1 steps that develop into a long-range healthy habit, that'll really give them a better lifestyle in the future. And they can walk, park a little further in a parking lot and walk into their office versus just parking as close as they can. And also we work with the playgrounds and the complete streets of infrastructure through our infrastructure task force at Polk Vision, where we want people to walk to school and have bike lanes to bike in so that they can make healthy choices and things that will really benefit them in the long run.
I can think of some other good habits of even folks that are a healthy weight. A good habit would be, how can you help other people stay healthy without stigmatizing, without being overbearing? You can do things to support a family member that needs to lose weight. You can do things to exercise together. Get out and enjoy Polk County. What a wonderful environment we have. Especially if you're an employer. You're really responsible for all these lives getting your job done, getting the business to work. And for large employers like Lakeland Regional, we know the health of our employees means the better service we provide to our patients. So if you're an employer, How can you help? And that's one of the strategies in building a healthier Polk. What can employers do? Because they touch the lives of hundreds of people. And are they doing something during work, knowing that it's really you as the patient, you have to do things at home, at play, and at work to stay healthy?
It's really a great way to look at it, because if you think about it, it's everyone really trying to come together and find those little things to do that make the big difference.
This is entire Polk County, because that statistic or that statement you said that we were the 7th obese area in the nation, that's available on the internet worldwide. I think it was a USA Today or one of these national reports. That's available everywhere. So we as a community need to pull together to make sure there's places to exercise, healthy places to work, and our kids are going to school in a place where not only are they getting education, they're getting good, nutritious food and activities that keep them healthy.
Excellent. Now, what are some of the things that you guys have planned coming up that might help to promote a healthier lifestyle for people?
We actually had a forum last summer that kicked off this entire initiative, where we brought stakeholders from all across the county, from, just like Dr. Haight just mentioned, with the school system. We actually had a Department of Agriculture team come in and meet with our small groups and our work groups to talk about the healthy choices and the different foods they're providing in our schools. And we're also looking at, that forum was very successful with about 110 different people coming together to talk about how important this is for our county. And then we also would like to do a kickoff event in the fall. We have different events going on. One coming up is Dr. Rady will be at Florida Southern College next week to talk about the correlation between physical fitness and studying for children, and talk to the education group there. So it's a cross-section of activities that are going on. Locally already, the city of Winter Haven has a great program called Fitness in the Park. And what they do is meet every Saturday, and you can take Tai Chi, you can work with a personal trainer, and it's open to everybody in the city of Winter Haven and all across Polk County to enjoy the park, but also have a fitness aspect to it, making those small changes.
Wow, exciting.
And also, because Lakeland Regional Medical Center is a not-for-profit hospital, we put forward a community benefit plan, and one of our areas of focus to make an impact is reducing obesity and diabetes. And you know what's going to have to really happen, that's going to have to occur as an ongoing basis? It's policy change. You can have an event and you can have a health fair, but that's just a one spot in time. To make something long lasting, you have to make policy changes. And just don't think that that's just for government. You can make a policy change in your own home. You can make a policy change if you oversee a work area. You can make a fundamental difference that is ongoing. So those kinds of ideas, I think, are really critical to get people to think more in light of not just a one-time event where you do a lot of planning and then it's over. This has to be evidence-based. You have to do things that have been proven to work, and then if you know they work, make that change in your life, because we all touch different areas. It might be at church, it might be at work, it might be at home.
Excellent. Now, I know that in some of the literature that I saw that you sent over, that it was between 37 and 40% of people in Polk County are considered obese. What are you hoping to accomplish as far as getting those numbers down? What is your goal as far as where you'd like to see that obesity level be?
We'd like to drop it below the state average, but we'd also like to work with physicians on BMI, body mass index. If the BMI can be below 30, that is a really good shift for us. All of the physicians right now, there is a legislative initiative that they are measuring BMI in their patients. We'd like to encourage them to look at the long term of how they can help their patients continually make those good choices and be cognizant of what they're doing physically and how active they are and the healthy choices that they're making as a patient.
And Lakeland Regional is really emphasizing the community. You know, not only are we taking care of patients inside the hospital, but emphasizing the health of the community. For example, getting everyone to just know their numbers. Sarah mentioned one, BMI. How many people know what their BMI is? Well, you need to know your weight, you need to know your height. And on the internet or through help of a physician, you can calculate your BMI and you start to learn what should that number be. Then do you know your cholesterol and your bad cholesterol numbers, your sugar numbers? You know, start to figure out these things. You get to know how you are doing health-wise. And then you talk it over with your doctor and you can make a plan that keeps you in good health. And often has to do with making sure your weight is not high. 30, 40% is way too many people that are obese. You think of all the achiness they have in their joints, the chances for a stroke and heart attack that increase because of overweight.
Well, that is very true. Well, this is all very exciting, and thank you so much for coming out and sharing with us this today.
You're welcome. Good luck with everything.
Thanks for having us.
To find out more information about the exciting things that Building a Healthier Polk is doing in your community and what you can do to take part, go to their website at polkvision.com, or you can like their Facebook page at Building a Healthier Polk.